Good morning, everyone.
Good morning.
Welcome to the committee meeting this morning. Everybody that's in the boiler room here, and presenters that are in here this morning. Everybody that's virtual, welcome to our meeting this morning. We'll have a public comment here in the beginning of the meeting on the agenda items only. And then at the end of the meeting, we'll have another public comment too that you could address the board again at that time. I'll call the meeting to order this morning with a prayer by Commissioner Cook, the pledge of allegiance by Commissioner Lutz, the roll call by Esther Cuddy.
Pray. Dear Lord, thank you so much for this time we can come together. Thank you for everything you've done for us, everything you do for us every day. Just pray for the country, Lord, and what we're going through. Just pray that we might get along and get things accomplished, Jesus. Also at the county level, be with the first responders as they go out every day and risk their lives to save us. Thank you, Lord, in your precious name. Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Roll call, please.
Good morning, Commissioners.
Good
morning.
Commissioner Goodchild.
Here.
Commissioner Barbell.
Here.
Commissioner Vaughn.
Here.
Commissioner Lutz.
Here.
Commissioner Cook.
Here.
You have a quorum. You may proceed.
Thank you. Adoption agenda. Anybody got anything they want to add to the agenda or put on the agenda?
Chair, I move to adopt the agenda as presented.
Or so moved by Commissioner Lutz, second by Commissioner Cook to adopt the agenda as presented. Any more discussion? Here none, all in favor say aye.
Aye.
Motion's passed. Action on previous meeting minutes.
Mr. Chair, I move to adopt the meeting minutes from the September 11th, 2025 regular meeting.
Or so moved by Commissioner Cook, supported by Commissioner Lutz to adopt the meeting minutes from the September 11th, 2025 regular meeting. That is the motion. Any more discussion? Here none, all in favor say aye.
Aye.
Motion has approved. Move into brief public comment period. Someone wants to address the board this morning on the agenda items only. We can do that. Yes.
Good morning, Commissioners.
Good morning.
Morning.
I had sent an correction to you yesterday via email, so just wanted to recognize that in case you didn't have an opportunity to read that. I had a miscommunication with the Democratic Party on the name of the canvasser that they are intending to have continue in that role. Alex Kirsch is actually the party vice chair, and he's not supposed to be the canvasser to be appointed. It is Chuck Stockwell, who is the current canvasser. And so that has been corrected in your motion, but just wanted to bring you up. That was my fault in miscommunicating through text with Deb as she was out of state. So just wanted to let you know that correction. Thank you.
Thank you.
Brief public comment period. Brief public comment. On the agenda items. Seeing none, let the record show that brief public comment was offered and they had one participant, which was Claire Freddy. We'll move on to the consent agenda.
Mr. Chair, I move the consent agenda minutes and the consent agenda items for the September 22nd, 2025 Committee of the Whole meeting be adopted with the addition of the correction on number 3, the canvasser.
I'll support that.
Been moved by Commissioner Lutz, supported by Commissioner Cook, to move that the consent agenda minutes and the consent agenda items for September 22nd, 2025 Committee of the Whole meeting be adopted with the correction on number 3 on the canvas. That is the motion. Any more discussion? Hearing none, all in favor say aye.
Aye.
Motion is passed. Move on into new business. First thing on the new business, the discussion regarding proposed health insurance renewal Brandon Waslack, Vice President of Operations, Brown and Brown. Morning.
Can I, Thank you.
Thank you, sir.
Thank you.
Give them the- give them the-
Yep.
Here you go. I got two.
Okay, thank you.
All right, so the Blue Cross Blue Shield renewal came in. It was high. So we went out to bid to Aetna, Priority Health, and HAP for plan options. All three carriers declined to provide a quote. So we went back to Blue Cross. We asked for different stop loss options as well as different plan options.
I'm sorry, what was the third one? Aetna, Priority Health?
And HAP, Health Alliance Plan.
Thank you. Sorry to interrupt.
Oh, no worries. Usually when those carriers decline, it's because they're non-competitive or they just aren't interested in picking up the liability. In this case, like I said, we went out and we got additional plan options, 6 in total at 3 different stop loss levels. So we went through and we compared all 6 of those at the 45, the 75,000 and the $100,000 stop loss levels. Only one plan fell below the state hard caps. Those state hard caps only went up 2.9% this year. So the bottom of the sheet you're looking at is the proposed plan. The base plan would move from the Simply Blue HSA 2,500 hide it up to a health plan to a $3,400 HSA style plan. Those rates are subject to the county moving from a $45,000 stop loss to a $100,000 stop loss. That would be the way to get under the hard caps. A little bit more on the renewal. The renewal was a 39% increase. So the stop loss level of 45,000 is no longer in the county's best interest. That's why we went and looked at different or additional stop loss levels. So your current rates and census, you're looking at a $3.4 million cost. If you stayed with the renewal, which you can't due to the hard caps, it would go up to 4.7 million. So when we went back to the table and we looked at the different options, we looked at the different stop loss options, we got that 39% down to 21.8% with a $4.1 million. So we'd have to make those changes to fall below the hard cap. And as you know, last year, the state hard caps only went up 0.2%. There was some legislation out there trying to correct some of that. I've been following, I believe it's legislation 6058. There's a little bit more information that they were updating, the state was updating in the past month, but that legislation is not moving. So we have been trying to keep a close eye on the state hard caps and what they're doing to potentially correct those levels. To go a little bit further in depth on the $100,000 stop loss level, what you're doing when you're moving from the $45,000 stop loss to a $100,000 stop loss level, you're reducing your fixed cost fees from Blue Cross. So the stop loss fees and the specific and the aggregate level, that move would save, $1.3 million in fixed fees. And then when you look at the difference between the $45,000 stop loss level to $100,000 stop loss level, you start thinking of how many more subscribers are going to hit before the stop loss level meets. And it's 11 subscribers, which is looking at 2024 as a full year of claims. You're looking at $770,000 of additional claims. So that move to $100,000 stop loss level would still net about $530,000 in savings, looking at 2024 is an entire plan year in claims. We did also request additional stop loss levels, from Blue Cross Blue Shield. Underwriting is still looking at those. I don't know that the county would want to go above $100,000 stop loss level, but for illustrative reasons, we're still requesting those, and we can show those once we have them. So in last year, you had two plans below the hard cap. It would have been the high deductible health plan with a $2,500 deductible, and then the Simply Blue 2000, which is the second from the bottom here. That is no longer under the hard cap. So you would move back to having only one plan below the hard cap. And the top plan, I don't know that it'd be financially reasonable for anyone to even accept that plan now that it's so much more expensive. What questions do you have?
Mr. Chair.
Yeah.
So you said the three that you went and checked on. Is there any other ones that you could check on to see?
So one of the carriers that comes up quite frequently is United Healthcare, UHC. UHC is not a network with Covenant Health Systems. So your members would not be able to go to Covenant. So that's one of the ones we didn't quote because it's not a good fit. You'd have too much disruption.
So, go ahead.
Brandon, this is a lot to wrap your mind around
I agree.
on a sheet of paper. I mean, going up to a 39.9, whatever it was, percent. And I think that reflecting, you brought it down by increasing or dropping, anyways, 100,000 to 21, like 22%. So basically, the common average employee would have a 22% increase. Do you have any? I see you have the rates here on the left-hand column or the plan. Could you pick one of these that's most common to this county and illustrate the difference of last year to this year in a rate increase? Or do you just take the 21% or 22 and multiply it times what you were paying last year? How would you look at that?
Well, if you look at the Simply Blue 2000 plan, last year that was a $0 plan. So this year you go as a single from currently 0 to 159.16 per month. A two-person would be 381.98, and a family would be 477.48. The Simply Blue 500 plan used to also be a very where a lot of your members were at. So last year at a single, that single family, or excuse me, single rate for the month was 110.94. So it would go to 301.40 for a month this year. And then a two-person is currently 266.24, and it would go to 723.36. So yes, and then the family is 332.81 currently, and it would go to 904.19. So large increases when you start looking at that 21% increase, and then the hard cap only going up 2.9%. That's where you start seeing that large jump.
So again, take 22% of what you're about paying now, whatever plan you pick, it's going to be your increase. Where do you see this going, Brandon? Because healthcare costs are skyrocketing, and the fact that billing codes are equally skyrocketing. They're trying to capture everything, and if you're not very good at auditing billing codes or have a good handle on it for savings, you really get stuck with a lot of. Where do you think we're going? Because this, from an employee standpoint, and we have unions here, this is going to be a very distinct interest in negotiating in terms of you don't want to lose as an employee.
Right.
This makes it very hard not to. because the other side of that is wage increases to compensate. And, yeah, it doesn't take a rocket science to figure out positioning on that, but from a county perspective, and the fact that we apparently can't get anybody else to quote, which is sort of interesting. Is that because of the high acuity cases in the county or well, yes, potential risk, potential claims?
Right. So we looked at claims, high cost claimants, 2024, the full year in 2025, year to date. Your top 3 claimants from 2024 are still on the plan, are in that same claims are coming through. So you have a few that are, continuing those high cost services. I don't know that will continue into 2026 or all the way to 2027, but there's 3 to 4 that are high on the list continuing from last year. And I want to get into too many details of what that looks like.
That's what, it is what it is, and very thankful they're taking advantage of it. Going up another level, it was a 3.4 million. I was just making notes here as you were traveling through here.
Yeah.
Or 4.7. What is it with the when you dropped it to the 21.8? I think it was 100,000.
Yes.
What is the annual premium then?
The savings on that stop loss change was
Yeah.
1.3 million in fixed
1.3.
fees.
And what's the exposure to the county in terms of?
Additional subscribers between 70 or 45,000 and 100,000 was about 11 subscribers or $770,000.
Are you going out to other counties with like news?
Sadly, yes. I have another one with a very similar stop loss increase, and they're not at 45,000. They're higher.
Well, as we know, the legislature's at a deadlock with 9 bills. I don't think they passed them. Maybe it was up to 9 by now. So the relief, but which was supposed to come, the raise is not there. So understandably, it really positions counties, townships with a burden that shouldn't be there. It's pretty substantial.
No, we would agree.
Yeah, well,
Yeah.
you've been here a long time. 10%
It's just-
used to be the same kind of reaction. Now we're getting, we're double digits and moving upward.
Yeah, if you were looking at a 10% increase this year, I would say, I would be happy for you.
We'd be,
Yeah, it's not what's happening this year.
yeah. Well, Chairman, there's a lot of questions. It's just on a sheet of paper. This is a lot to pass through. Do you, how are we going to bring this to the employees? I mean, I'm sure you'll have a lot of questions. I'm sure it's all been set up. But, because it's almost January.
Yes.
Do you have any other recommendations for the county?
Right now, like I said, the goal is if I look at those other stop loss levels, I want to see if we can reduce the fixed fees enough to get away from that 3,400 plan and get into a different plan, maybe closer to the 2,500 plan that's current. But with the amount of claims that are coming in, there's a lot of cost to the plan. Blue Cross is writing the illustrative rates based off that. If you look at prior years, like 2024, you were at the $45,000 stop loss as well. You actually paid in less in fixed fees for that stop loss than the stop loss credits you received. So that year you did really well when considering you got more back than what you had put into the stop loss level. That level of claims is now coming here, and Blue Cross is, rating the stop loss fixed fees according to that.
And is what you're suggesting earlier, I mean, the top plan, the CV1, is pretty much out of the realm, but
I agree. I don't think it makes sense to continue that one.
And the next four would be the options the employees would have. I think the employee should have a stop loss. I think you have to choose between medical or not, depending on ability to pay.
Right. So, there are options as far as instead of hard cap, could you do an 80-20? And we could do a side-by-side comparison of that. I'm not suggesting that because I know that's that's something that have to be approved, but you could look at how that compares across the board with those four plans.
I was thinking you was gonna bring that up, 80-20, but,
I'm not suggesting it, but
No.
it's something we could
but just
illustrate.
for comparative purposes, because the market's driving.
Yeah.
What? Hospitalization's driving it. No. Sharon, I'll defer back to you. This is mind-boggling.
Is there any more questions for me at this moment? Not that I just look at thing, well. Appreciate you coming in.
Anytime. Thank you. Have a good day.
Thanks. Under new business discussion regarding benefit strategy, Brian Bellware, Manager Principal Gibson.
Good morning, Commissioners.
Good morning.
Thank you for having me this morning. In your packets, you should have a piece of information that looks something like this. Spend a little bit of time with you walking through some of the work that we have done with your team at your request of looking at some alternative options for benefit strategy. So again, my name is Brian Bellware. I'm with Gibson. And no, we are not a guitar company, if there's any guitar enthusiasts. We are a risk management firm, corporately headquartered in South Bend, Indiana. Our Michigan office was opened in 2017, and we have been growing our market. My role is the managing principal for the Michigan market for Gibson. And we have been working with a neighboring county, Sanilac County, for a number of years. And so we're going to share a couple things that we've been doing with them, as well as some other work that we're doing in this realm of health benefits. We recognize that you're facing a large increase. We recognize that there's some challenges with that from an employee standpoint, from a ability to attract and retain talent. And so we're going to offer a little bit of an alternative approach that we have found great success, not only working with other counties and municipalities, but working with organizations of all industries and sizes. So in your packets, I'm just going to reference the page numbers from our presentation. Pages 2 and 3 just share a little bit about Gibson and the organization for us. So one of the pieces of our story that I'd like to highlight, being corporately headquartered in Indiana, operating in Indiana since 1933, what we have found is the state of Indiana is about 5 to 7 years ahead of Michigan in terms of innovation around health benefit strategy. So healthcare costs in Indiana are far more expensive than they are here in Michigan. We don't have a major dominant player like Michigan does with Blue Cross Blue Shield. And Indiana doesn't have the same level of influence of the big three auto. So the industry is a little bit more varied, a little bit more diversified. Certainly there's a lot of RV, but the auto industry is obviously very dominant and influences many industries within Michigan. So there's some different factors, but as a state, Indiana is far more progressive. So when I was looking for an opportunity in 2017, I had an opportunity to learn a little bit more about what Indiana was doing, what Gibson was doing in Indiana, and felt like their approach of risk management would fill a hole in the Michigan market. And so we've been bringing that approach that I'm going to walk through and share a little bit more details on into Michigan market. We're helping organizations move from fully insured to self-insured. We're helping self-insured organizations like yourselves better manage the risk of your group health plan and stabilize cost, stabilize value for employees over time. So we're going to share a little bit more about some of the work that we're doing. We're going to share a little bit more about the model, some specific examples, and then I have some recommendations for you all relative to your specific health plan experience that we'll talk through and introduce. So that's what I have on the agenda for today. Does that sound fair enough? All right. I want to highlight page 3 real briefly, which is the map up on the screen. This past summer, Gibson joined a organization called Unison Risk Advisors. And so Unison Risk Advisors is the 38th largest broker in the country. So Unison allows us to maintain our independence, maintain the local service that we have within our local communities that we're operating in, but brings the national resources to the table to help support organizations. So you can see the map of where they're at in Gibson as one of 7 platform agencies. So I just want to highlight that, and you can see some of the details there about Unison Risk. So moving into some of the work that we're doing in page 4, what we believe when we look at any group health plan, whether you're working with a carrier like Blue Cross Blue Shield or you're self-insuring in other models, we believe there are 7 core components that are going to dictate the performance of your health plan. So I'm not going to go in depth on any of these. If you have specific questions, I'm happy to go as in depth as you would like. But as a high level, there's really 2 things that I want to highlight here. So the very bottom 3 that are shaded in gray, transparent advisor relationships, plan design, documents and risk management, and plan administration and oversight. This is what I would refer to as the infrastructure of your plan. So a comment was made earlier about looking at some of the billing practices. And so when we look at the entity that you hire to administer your plan, we believe it's really important that you're hiring and working with somebody that has aligned interests with you as a plan sponsor, meaning they're operating the plan as if it was their own. Their interests are aligned with yours. So when we begin to look at some of the different pieces, your carrier, your administrator, your pharmacy benefit manager, your stop loss vendors, and your advisor or broker, those relationships are really important. And what we're trying to do is introduce and engage with entities that are aligned with your interest. Fees need to be transparent. Fees need to be aligned with your interest, meaning I, as a broker, don't want to get paid more when your costs go up 39%. So what we have for the last 15 years is brought to the market an independent fee-based relationship. So that in this case will be cost neutral from the commissions that are currently being paid, but the structure of that means that I have an interest aligned with yours. If your costs go up from the actual healthcare side, my fees don't change. Whether you're fully insured, self-insured, our fees remain flat and transparent to you all. So that would be an example. Partnering with carriers that are administering benefits. They're auditing claims. They're making sure there's not overcharges and duplicate charges. Those are all really important ingredients from a carrier or administrator. And having stop loss partners that are aligned with your interests as well. So those are all infrastructure pieces that we help an organization evaluate. We bring strategies and solutions so that you have aligned parties that are driving the infrastructure and experience of the plan. The top 4 components are all what we refer to as the care components. So this is how your employees are actually interacting with the healthcare system. So this is looking at primary care. This is looking at the network or access arrangements that we have. We're looking at how we're managing high cost claims. So your 39% increase is driven by high cost claims. That is the number one driver that is driving those increases. And when we see the industry overall receiving these large increases, it is high cost claims. The prevalence of $500,000 and $1 million claims has skyrocketed over the last 10 years. And I'd be happy to share research that supports that assertion. So this is what the market is really dealing with and challenged with right now from a carrier standpoint, as well as some of these other independent options. So how do we manage those high cost claims? Some of the work that we're going to share and examples and recommendations are really focused on that. We believe that if we can manage high cost claims, we can create stability in a group health plan. And we've got the results to prove that. And the very top part of the high cost claims that we see skyrocketing is pharmacy. So these are your gene therapies, these are your biologics, these are your GLP-1 drugs that are being expanded for more and more cases, including weight loss and sleep apnea and different disorders like that. But the pharmaceutical drive within any plan is significant. And in the analysis that we did on your plan, there's significant opportunity from a pharmacy standpoint. So these are the overarching care components. These are the overarching components of what we're looking at as we're building high-performing health plans. And these are the things that we will begin to introduce. We don't have to tackle these all in one year. We can tackle them over time and build a strong foundation and then just continue to build on that based on your specific organization, culture, values, as well as the actual risks that you all are facing that might be different than some other organizations. So let me pause there. Any questions on Gibson overall or any of these components, how we approach and look at the market?
Sean, I have a question. Very well. I appreciate what you're doing. So I understand, the high cost plans is 80%, probably 80% of the cost. You just apply Pareto to it. Especially with the emphasis in the last few years with increasing the number of coding items to code to capture more costs to cover, as you know. And they threw the 340B out there a few years ago, and I'm not even sure. There's a lot of controversy on that with the Mackinac Center in terms of what it does and what it doesn't do in terms of rising costs. So what you're doing, you're focusing a large percent of your time on the major claims to make sure, which would make sense because that would be the most capturing in terms of any medical community. But on the other hand, don't you think there's a crescendo below that and outside the acuity in terms of the breadth and depth of the building codes that are constantly being created in this expansion? I mean, you also look at that as well, right? Because managing the billing is so important today. And I have enough experience to know what it looks like, pro and con, from the hospital side and from the insurance side. So this is what you do, right?
Correct. Yeah. So we are not a claims administrator specifically. So our role is an advisor. We function in that seat of advisor consultant. And so as a part of being a risk advisor, we're going to broker insurance because insurance is one way that we manage risk. But as it relates to digging into the actual administration, the payment integrity, the audits of those, we have a playbook of strategic partners, so third-party administrators, payment integrity vendors that do third-party audits that we would bring in and introduce as a part of an overall strategy.
Okay.
Absolutely.
Thank you.
Great question. So let me share a little bit more specifically on some different examples of some of the work that we do. So on page 5, you have a case study of a neighboring county, Sanilac County. Again, we've worked with them for a number of years. And we have had a lot of great success with their plan. So they are a self-insured health plan. They are working with an independent third-party administrator. They have an Aetna network. And we have built a direct contract between Sanilac County and Mackenzie Health System, which is the local community health system in Sandusky. And so that has taken some time to build. That's not just an overnight flip a switch and we have it built. Mackenzie may or may not be a good fit for you guys to plug into that, but you have other health systems within the county that we certainly can begin to engage in those conversations long-term. So we can replicate what we're doing with the county from that perspective over time. That's not going to be an immediate solution for 2026 because again, those are fairly complicated contract negotiations and conversations. But the direct contract with the county and the hospital in Mackenzie has been a great success. So what I'll share with you is that in a current carrier model, Blue Cross Blue Shield is negotiating with the hospitals. And if we take a common denominator of a flat reference price of Medicare, so the federal government establishes fair reimbursement for hospitals, and that's the Medicare rates. Blue Cross Blue Shield on average is probably around 250 to 300% of Medicare. When we go into some of these local community hospitals and we establish direct contracts, those are typically somewhere in the 120 to 150% of Medicare. So the gap between, let's just call it at the high end, 150% and 250% from the carrier, that is all savings to the health plan. So we're taking those claims that are going through the hospital and we're negotiating a direct contract to pay less than what you're paying today through an insurance carrier. So that's one of the reasons that we've had really good positive success with Sanilac County. We're also sourcing pharmaceutical prescription drugs in alternative ways. We're going direct to the manufacturer. We're sourcing internationally. On average, since we've had these programs in place, we're saving the county over $1,000 per employee per year on pharmaceutical. The employees are getting the same drug, same dosage, same frequency, same quality drug that their doctor is prescribing, but we're getting it at no cost in most cases. About 85% of the time, we're getting that drug at no cost to the employee, no cost to the plan. It's a very smooth experience, very white glove experience for the employees, and it's been very positively received. It's highly effective at taking the specialty drug. So any drug that you have that's over $350 a month, we're sourcing that in alternative means and cutting the cost significantly for both the plan and for the employee. It's a really, really positive benefit. County's had great success. We'll share a couple additional pieces on that. We also are managing some of the large cost claimants with some other strategies that we'll deep dive into in a moment. But what I want to highlight on this page is just the graph. So what we do is we look at, this is a third-party actuary that's looking at claims, and you can see from July 22 through March 2025, over the past 3 years, you can see the claims line. It's going down. So in an industry where everything is going up, the cost of claims are going up, the cost of insurance is going up, we have a county that's very similar to your county, an employee base that's very similar, demographics that are very similar, size that's very similar, and we have a 3-year track record of that going down.
Sure.
This,
So it shows the cost of claim. Is this the cost of claims or the claims going down, or both?
the cost of
Cost of claims. So the claims could be relatively plateau or increasing, but where you're benefiting is the cost of it.
Exactly.
Okay. Yeah. Understood. Thank you.
So this past renewal cycle, we delivered a 3% decrease to the county. That's unheard of in the industry that we're in today. A 3% decrease. This is not an anomaly. We have another group in Grand Rapids that we delivered a decrease for. We have other groups that are experiencing very similar things throughout Gibson's book of business. By adopting these components, managing the risk, and sourcing and accessing drugs and other things through different means outside of a traditional carrier. We've also, in this model of the direct contract, we've reduced employee out of pocket by 38%. So deductibles, co-insurance, co-pays that employees are paying out of pocket, we've been able to reduce by 38%. Very positive experience for the employees. So Sanilac County, we've done a lot of work with Nathan Roski and Jody Morris. They've been fantastic in being able to evaluate and really bring these strategies to implementation with buy-in. So there's a lot of work that's done within the union leadership, within the board leadership, and obviously within the administrative leadership to navigate these types of changes. Again, it's not a flip the switch. We're going to buy a different product. This is over time. We begin to adopt and move forward with this strategy. We can begin to create a different long-term path. On page 6, we have another example. This is one of the strategies that we will be recommending for Tuscola County. This is one way that we can begin to tackle some of your high-cost claimants. And this is by leveraging foundations. So I mentioned earlier that the prevalence of high-cost, $500,000, $1 million, $2 million claims even is escalating rapidly. The market has responded in bringing some of these foundations that are collecting donations to support employees that are going through scary medical situations. So these are your cancers, these are your hemophilias, these are your heart disease that are going prolonged over multiple years. These are your high cost claims that are ongoing year over year over year. And you have some of those within your population. So what we're doing in this strategy is we are working with the foundation to help support the member. When the member engages, which is a voluntary basis, they have no cost. So there's no premium cost and there's no out-of-pocket cost. So they, for the duration of this medical condition, will have free health care. No premium, no out-of-pocket. They're going to enroll in the ACA marketplace, and they're going to have the support of the foundation to help navigate that process and support all of their costs associated with that through the foundation. It's all covered and reimbursed. What it does for the county is it shifts that risk over to the ACA marketplace. When the medical condition is done, they come back on the county's plan and continue. Okay. So it can be a very effective way at managing high cost claims for the county. It is also a very powerful benefit that you can offer to your employees, because anytime an employee is going through one of those high cost conditions, there's two challenges with it. One is they've got to navigate through the medical, right? They've got to navigate through a cancer scare. They've got to navigate through maybe a disease like a hemophiliac and manage that. Right. So there's the medical component of that's a huge challenge and stressor. But then the other one, and some research actually suggests this is even harder, is the financial burden of that. Managing the medical bills. We know in the United States, medical debt is one of the leading causes of bankruptcy, of personal bankruptcy. And so the challenge outside of actual dealing with the disease and dealing with the medical condition is the financial. You're eliminating that financial component. You're giving your employees a benefit that would say, we're going to eliminate the financial burden of this. You go focus on getting better. You focus on the medical component, and the financial component's taken care of. So really, really positive win for the employees that are going through these situations. Keep in mind that this is probably 2 or 3 employees a year. This is not going to be every single employee. This is not your $10,000 or $15,000 outpatient procedure. These are your high risk, high cost claimants where we know that in the coming year, we're going to have a $200,000, $300,000, $400,000, $500,000 type of claim. The example that I've shared here on this slide is another group that we have here in Michigan. Pay attention to the red arrow. They have 4 claimants that are driving $2.2 million of projected claims. The fee to engage the foundation is $355,000 for the 4 members. If the member is the member that has the condition is an employee and they have to have family coverage, the family follows them onto the ACA Marketplace plan and they're covered as well. So the net savings in this situation is $1.8 million. 4 claimants driving $2.2 million of claims, and we can create that level of savings through a really, really positive benefit for your employees. Okay. Can't mandate this. This is a voluntary program. Doesn't impact your relationship with the Blues at all. So employees can stay on the group health plan if they want. This is purely voluntary. We're simply offering it as an option for those folks that may be eligible. But really, really positive impact. You can pause there. It's a new concept. Any questions on that strategy?
Chairman, I have one. So you're saying this is going to take a period of time. What kind of time are you talking?
So this strategy
Yeah.
can be rolled out for this cycle. Yep. So this.
So
would
you
be-
would work like, I'm just going to throw out Covenant. You go to Covenant and say, hey, we want to partner with you guys. You would do that starting in 26.
So the strategy for the foundation can be this cycle.
Okay.
A direct contract is a little bit longer.
Okay.
So if that was something that you all as a group prioritize, those conversations would start in 2026. We would prioritize that. And if we gain buy-in from Covenant, could be ready for 2027. So that direct contract type of relationship is a little bit longer. Great question.
John, Brian, very interesting concept. When you, of the 3 cases, just say that, and you move them into the ACA, which is, in most people's minds, is not a great option. Do you seek similar, the same, what type of coverage when they leave a Blue Cross like this plan? What kind of coverage do you seek out? And then I'm capturing that a foundation of some type makes up the difference somehow. Right? Is sort of that's the high level concept?
So when we're helping an employee navigate into the ACA marketplace, what we're primarily looking at is the network and the participating providers, because we don't want any disruption in care. So if they're going to University of Michigan Health System, they're seeing a specific specialist. What we're going to validate first and foremost is that any plan that we're looking at within the ACA is participating. It's covering their prescriptions that they're taking, it's participating with the facilities and providers. That's the most important thing. The plan design is really less significant because we're reimbursing any out-of-pocket. So it's going to be a better benefit than what you can offer with the group health plan because it's essentially no cost. So even if they buy a bronze level plan in the ACA market, all of their costs are going to be covered. But what they're trying to do is they're trying to find a similar plan to what's being offered with the group, prioritizing the network and the access piece so there's not disruption there.
At a lesser cost.
As well as the premium and out of pocket. So again, for the employee, this option would mean they have 0 cost for healthcare.
So from the footprint that the employee or the patient or however the claimant, they would not see any difference in care.
Correct.
Okay. I'm trying to capture this because it's sort of an interesting concept. How does this, just give a Cliff Notes version of the foundation. How does this foundation work to assist? Where does it get its revenue from? How do you capture it?
So there's donors that donate through foundations to help support folks with medical bills because medical bills are such a driver of personal financial hardship and bankruptcy. There's foundations. So again, as the prevalence of these high cost things have risen, these foundations have come from wealthy donors that are trying to support these types of members.
These donors exist these, right, versus we have to find the donors?
Correct. Yep.
These donors exist. It's just, it must be at a high enough level as other companies like yourself tap into it. They must have a fundability that's pretty exceptional.
Absolutely. So you are paying a fee as an employer. So that in this example, the 355 is a fee. So you're paying a fee to engage the foundation that's operating these models. And they're out soliciting funds. They're out managing that aspect of it. They're determining the eligibility. That's not something that's going to fall on your team, our team. There's specific eligibility that they're following. So your fee is paying for the foundation to do what they're doing. And then they're funding all the employee out of pocket and premium.
That's somewhat answered, filled in a blank that it, the 355 is basically engaging a foundation.
Yep.
That will grow and seek funds. Are they pretty successful in your?
Very successful. Yep.
In targeted? Why isn't this more acceptable? I mean, this is some of the new concept. What's going on? That is this because of the COVID and the rise of all the issues with the COVID? I mean, obviously the costs are rising, driving from whatever, but that's probably a main driver. So do you have competitors that do the same thing?
So I'm going to come back to the care component or the 7 components that we talked about earlier. The very bottom one was transparent advisor relationships. So when I, as a broker, get paid a commission on your premiums, I'm financially incentivized for your premiums to go up. I'm not financially incentivized to bring strategies like this to the table. Okay. So 95% of the market buys healthcare through traditional insurance brokers. Their financial incentives, their fiduciary duty is to the carrier for the products that they sell, not to the plan sponsor. I want to be very clear. That doesn't make them bad people. That doesn't make them evil. That doesn't make them immoral. That's just the business model. And that's the business model we've operated in for 20 to 30 years. We are doing something different. We're part of the 5% of advisors that are out there bringing risk management strategies to the table. Because again, whether you adopt this foundation assistance or not, it doesn't impact our compensation in any way. We're bringing this because it's an effective solution for you all to help manage risk and stabilize the cost of your health plan.
Let me swing back into more detail. It seems like it's a very viable opportunity, especially for someone who's been diagnosed with a disease that qualifies for such exorbitant costs. Seems like that's covered. They have no out-of-pocket cost, and then they concentrate on getting well. Does the savings, I know that's in the, say, 3 or 4 clients, it seems like it's been most of your time there, but as far as the rest of the group, do the other employees that are not in the acuity level high claim, is this a trickle down? In other words, you had 30-some%, whatever it was before. Do they enjoy that, or how? Or do you have to do the same at a minor level for all the claims of everyone else?
Yeah.
You have a group that reviews all the billing, sort of fill that in.
Sure. So in this example that I've shared here on page 6, if we evacuate $1.8 million of expenses off of the total plan, everybody else that remains on the plan benefits from the lower cost, right? So that would be one way. This doesn't mean that we're not looking at the group that remains on the plan and bringing strategies to help manage that risk, to help them access. And that's where the direct contract, that's where the pharmacy, that's where some of these other strategies come in for the folks that are on the group health plan. But the benefit to everybody else, maybe some of the folks that aren't high claimants, is we're lowering the overall cost. So that directly impacts their premiums, helps us to maintain plan design so we're not continually shifting costs, raising deductibles and things like that. So they benefit in that way.
So it does trickle down.
Absolutely. Okay. Page 7 is just talking about the pharmacy work that we're doing. So this is our book of business on the pharmacy. This is with one vendor. We have multiple vendors that we're implementing various different strategies with. This is one vendor. I'm not going to read all of the numbers on average savings per employee. When we look at across the entire book of business is $1,400 per employee per year. I shared Sanilac County was about a little over 1,000. But our average, we have 1,400. Okay, so, and again, this is being done. You can see several thousand employees are being supported by this. Over 2,000 users are being assisted by this. So this program works. It's validated, it's proven, it's predictable, it works. And so this is addressing your pharmacy drug spend over $350 a month. So those are, again, a little bit about the work that we're doing. First, from an overarching standpoint, shared a little bit of information on Sanilac County, a little bit of information on 2 strategies, and both of these strategies are strategies that we're recommending for this coming cycle. So page 8, I'll go through that recommendation. When we put these recommendations together, we put them together in what we call crawl, walk, run. And so what that means is that we're going to come at your pace. Okay. And when we originally put this together, I think we probably had some options relative to the direct contracting conversation under the time frame of where we're at today. That wouldn't be something I would recommend. I think it would be really hard to do just from a feasibility standpoint, getting Covenant on board, working through the contract, all of those pieces, but it would also require significant change. And under the wire with January 1 approaching quickly, that wouldn't be a recommendation. But I think the crawl, potentially even the walk, both would be. And so what we're recommending as a path forward to help mitigate that 39% without shifting cost to your employees in plan design, without taking on additional liability, is 1, leveraging the pharmacy. So what we would do is carve the pharmacy relationship out from Blue Cross Blue Shield. We'd work directly with a pharmacy benefit manager. That contract would be between the county and the PBM. Right now, it's between the PBM and the carrier. And so the contract is in the best interest of the carrier, not the county. So we're going to establish a contract with the PBM that's in your best interest, maximizing rebates for you, lowering costs wherever we can. And then we're going to engage with the concierge program to source those high cost drugs that we shared earlier. Okay. We would forecast savings based on your claims experience between $300,000 and $350,000 for annual claims in pharmacy. Okay. So we see the pretty significant opportunity on the pharmacy side. We would also recommend implementing the foundation program. Again, that doesn't interrupt your relationship with the Blues at all for this coming cycle. It can be offered as a voluntary option in relative ease for this cycle. Okay, without having detailed claim information based on claims through August, it's hard to forecast what exactly that looks like. But again, we're focusing on those high cost claims. So we're focusing on those folks that are probably north of 100,000, 150,000, and you do have a handful of those that are on your plan, at least based on the data that we reviewed from the carrier. Now, the caveat to all of this is in order to carve pharmacy out from the Blues, we also have to carve the stop loss out from the Blues. Blues will not cover your pharmacy on their stop loss if it's carved out. So we would also be going to market and looking at alternative stop loss carriers to bring a stop loss solution. And we'll look at the various different levels, 45, 75, 100, 150. We'll look at all of that. And our data analytics team will do the analysis to make a recommendation on the stop loss deductible. But when we look at stop loss and we're carving out high cost drugs, which is a stop loss driver, and we're carving out known risk through the foundation, we have a very compelling story to tell to the stop loss carriers. And so we're going to go out to market and do that work. So what, from a timeline standpoint, what we would recommend is if we move forward over the next 2 weeks, we'll go through and do all of that analysis and work, stop loss, pharmacy, foundation, assistance. And then in the October meetings, I think the week of October 13th, we would come back with firm proposal budget numbers. Okay. So until we're sitting in that broker seat and working with the carrier, we can't go out and truly get those firm numbers. So what we're recommending is a strategic approach with some levers that we can pull this year to give you an opportunity to save on some costs, again, without compromising the value of your plan. And then long term, we would be looking at the direct contract. We would be looking at other strategies that fit within those components. Okay. The last few pages just share a little bit more information about partnership, what we deliver as a part of a package, services that we offer, introduces our team. You will have a local service person. She actually lives in Howell, and so not too far from here. She's the one that supports the groups that we have in Sanilac County. And then the other person on page 10 that I just want to briefly highlight is Cheryl Lee, the top middle column. Cheryl is a registered nurse, and so she sits in a clinical consulting. So once we have access to your data, Cheryl is going to go through that data, that clinical data, and look at it from a clinical perspective. She's working with stop loss. She's working with case management. She's working behind the scenes to really do a lot of the clinical recommendations for the risk of your population. So she's a really invaluable member of our team and brings a differentiation for most firms. And I'll wrap up page 11. Unfortunately, I can't stand here and give you guys a money back guarantee. I would lose my license if I did that, and I would be selling guitars. But what I can do is offer this promise that if you and your leadership team don't feel like we're making progress towards the strategy that we've outlined for you, we'll make the transition back to your incumbent broker easy, no strings attached. Okay. From my experience being on the side that I'm on now, as well as for the first 10 years of my career, I sat in your seat as a buyer of insurance. I sat in the HR seat for a large organization. I know that this is not always done. Brokers can make it really difficult to make transitions. So our commitment to you, if you don't feel like we're making progress, we're going to help you transition back, no strings attached. Okay. With that, questions?
Any more questions for you? Very interesting, all of this.
I have questions. If you're gonna wrap it up.
You
I know.
get it, don't wrap it up yet. Go ahead.
I noticed Brandon left pretty fast. So I was thinking the fact that this is not new to you when you go in and you're gonna work with a carrier, but when you start to talk about subrogating or replacing like the pharmacy or moving it out and getting contract. And for this county, I think from what you mentioned, it was around 355,000 somewhere, which is pretty substantial. How do typical carriers like Carnival, they're going to react to this when they lose that pharmacy? They're going to see it erode and lose their stop loss. How do they react? Is it price reaction?
Yeah, that's a great question. So they're going to have penalties when you carve out pharmacy and stop loss. Both of those penalty fees are factored into that net savings projection. So they don't like it. It's a huge revenue lever for them. Your administrative fees might go up a little bit. Again, that's factored in as best we could project. So the pharmacy is a major driver for carriers from a revenue standpoint. So they don't like it. What we have found is as we and others are bringing these strategies to the table, the carriers are starting to get more open and innovative because they're seeing that they're losing business as a result. So I'll give you one example. On the third-party administrator side, they have actually partnered with a third-party administrator called Blue Water and are offering their network with an independent third-party administrator. So an administrator that's going to audit claims, as an example. That's not something that existed 5 years ago. But they're seeing the market evolve and they're recognizing that the demand to work with independent TPAs is there and they're starting to react. So it's over time, as they lose business in this way, they're going to have to start adjusting to what the market's doing. And I've seen that with TPAs. Priority Health has done the same thing. They just acquired a third-party administrator and shifting a lot of their large self-insured business through that model. Blue Cross Blue Shield is a mammoth organization, right? It's the 800-pound gorilla. It'll take them time to make changes, but I think over time they're going to start adapting to the market. In the meantime, short term, they're going to hit you with some penalties, but the cost still is positive.
Are from your experience, are the penalties, and we'll just use Blue Cross whatever, they're not substantial enough that we would wish we wouldn't have made a decision, are they? In other words, they're not going to be a cost driver in terms of raising the rates for the employees.
Right. So the 300 to 350, that's net of those fees.
Okay.
So I've already factored those fees into those numbers.
And when you start your strategy, where's the low hanging fruit? Where do you go to? What do you first? Is it pharmacy or do you go to the high claim? Where do you start?
So we go to high claims. Pharmacy is usually part of that because pharmacy is a driver of high claimants. That's our starting point. Pharmacy is the most predictable, proven strategy that we can bring to the table. The variable, in full transparency, the variable is going out to market and getting competitive stop loss proposals. So if we can do that through a combination of sharing the story of what we're doing on the pharmacy, sharing the story of what we're doing with the foundation, we can implement the pharmacy strategies. Very confident that the savings will come from there. Again, it's a very predictable model. The foundation is a little bit less predictable just because it's voluntary. So employee can choose yes or no. It's a pretty compelling story if they understand it. That's where we'll work with Shelley and the team from a communication and open enrollment and really making sure that we help educate the workforce on what the value of the benefit is so that they can make that educated decision.
All right, and on the pharmacy side, when the 340B was started, there was a great concern that it would take business from the local pharmacies. Matter of fact, local pharmacies really got up and when, in terms of contracting with what you do you see it more concerné? I mean, will we see the same issue with our local pharmacies from your experience, or is it all mail order or a combination? What's your thoughts?
So the high volume of generic and lower cost brand name drugs are going to continue to flow through the local market as they are today. Where we are sourcing is the high cost drugs. And that's not going to be the same volume. Again, we're talking about a relatively small ratio from your overall population, but it's high cost. Right. And that's where you're going to see the impact. Those are being sourced directly through the manufacturer. So we're bypassing the PBM, we're bypassing the local pharmacy, we're going direct to the manufacturer and getting those drugs, or we're sourcing it internationally. So that there would be an impact from that. But the high volume, the everyday generic brand name drugs, those are all going to be, sourced through your local pharmacy and the pharmacy benefit manager.
Obviously, whatever the impact, the key is lowest cost to the holder who's ordering. So I just wanted to see if it was going to be your experience. You had similar local concern or not, but needless to say.
Sure.
Appreciate your presentation, Becky.
Any more questions? Appreciate your presentation.
Thank you all. We appreciate it.
We'll turn Shelley up here. And talk to the board from Shelley.
Sure. Good morning.
Good morning. Let us know But if you got both sides of this today, let us know where we're at, what you've talked to, what you discovered, where you're at.
Here's where we're at. So, we approached 4 different brokers. Brian's company came to us recommended from Sanilac County. He is actually the only one who responded. What this would mean is that we would not have Brown and Brown as a broker. Gibson would become our broker. It's a little bit like stepping off the ledge, but we have to do something to contain these costs. We did not receive any update. Well, we didn't receive our renewal until the end of last week from Brown and Brown, which is what brings us here today. And therefore I couldn't really carry on conversations with Brian until this week. Now, Brian and I have spoke probably every day this week, 2 and 3 times a day, trying to figure something out for the county. So the best thing that we feel is for the county is we keep our blues where it is. We really don't have a choice. The worst case scenario is that we are with what Brandon provided to you guys. I do not have a copy of. So we've kind of been, if we really pushed Brown and Brown to be here today because they wanted more time. But then if we do that, we're locked in. We're locked in. And Brown and Brown has been amazing. They're a great company, but we need to start looking at options. I believe Erica also has some numbers. I don't know if she wants to share. Our relationship with Brown and Brown would be dissolved. And that has to be a decision that this board makes today in order for Brian to be able to do what he needs to do to move us forward. So we have talked, Brian and I have talked, as he mentioned, in the future of trying to form a relationship with Covenant. That doesn't stop you from going where you want to go. It's just less cost to the employer and the employee if he's able to secure that contract. It's been a rough ride. As Brandon said, carriers do not want to quote us. They're either not competitive or because of our usage ratio. And I've had conversations with Nathan, and they have had great success in this program. But as I've explained to Brian as well, I do not believe Tuscola County would be interested in a contract with McKenzie. It would have to be something different. But I do see that carving out the stop loss and the prescription drugs is a cost savings to this county. Again, apologies for the late presentation, but we really did have to push Brown and Brown to bring something forward even at the end of last week.
Any questions for Joe? I've been working on this.
Tell what I do. What's the timeline?
Timeline for,
Well, dissolving Brown and Brown, is it today?
it is today.
It is,
Yeah.
that's why
I was
we-
sensing it was.
It is today, and as I said, the reason that came about is Brown and Brown didn't come in until I think last Wednesday or Thursday, and I really had to push that date. And as Brandon said, he's still trying to acquire numbers through this duration, speaking with Sanilac County, speaking with Brian. And we can either stay where we are or start working this way. So if we do it today, Brian and his team would start working on what he's presented to you immediately.
And if I may,
Yeah.
if we do not make a decision today, it is too late for Gibson to go and begin getting any of these cost savings in place for 1/1. So that's why it matters for today. That doesn't mean, we could stay with Brown and Brown and we could engage with Gibson on 1/1, but that would mean that the cost savings would not begin 1/1.
Well, we always talk with Brown and especially Mr. probably what our future looks like. Of course, he has no idea what our future looks like, and we're going from here. With the presentation we heard today, we got a kind of idea what our future could look like moving forward. We all agree. I think we really need to do something. But
Chairman,
yeah,
I can't imagine that October, I guess, why do we have to make the decision today? We couldn't have a special board meeting next week. As one commissioner, I just would like to do some inquiring about Gibson, and I'm not
Sure.
questioning
Sure.
whatever.
That would
But
be
I
a
have-
question for Brian.
Yeah.
If we don't sign today, what his firm would be able to do. Or sign prior to October 1st.
We have 2 days next week that aren't October 1st.
Sure, absolutely. Board's okay with that? Brian answers that
yeah,
question.
come on up, bro.
So typical turnaround for stop loss, which again is going to be the critical ingredient to whether we can move forward with some of these strategies, is 2 weeks. So this time of year, that's hard to get 2 weeks, just because the volume of everything that's renewing for 1/1. So 2 weeks would be aggressive and we would have to push really hard. So that brings us to, so today and tomorrow, full 2 weeks of doing that market analysis. That brings us to that October 13th date, which I believe is a committee meeting that Monday, and then this meeting the following Thursday. So if we wait until next week, we're cutting into that already tight timeline for the stop loss piece. So that would be the impact of it. So that's the biggest challenge from that perspective, is just the stop loss market and the time that it takes for them to go through and do the analysis.
And Chairman, and to let everybody remember that we're going to be gone Tuesday, Wednesday, Thursday next week.
So
Well, Chairman, if I may, and I appreciate what you're saying, because you are the insurance, but I see a sense of urgency here that's been foreshadowing for a number of years.
For a while,
I mean, we lived with the 10%, the 9%, and this was, we said 39%. It just stunned me. Therefore, we'll just see where this goes, but move to approve the Gibson to be Tuscola County broker of record effective October 1st, 2025, with a term of 24 months with all signatures authorized as necessary.
Support.
Been moved by Commissioner Brightwell, supported by Commissioner Lutz. The move to approve that Gibson to be Tuscola County broker of record effective October 1st, 2025, with a term of 24 months with all signatures authorized and necessary. Is there any more discussion?
Like a roll call.
We can do a roll call vote on this, Madam Clerk.
It's been moved and supported to approve Gibson to be the Tuscola County's broker of record effective October 1st, 2025, with the term of 24 months with all signatures authorized as necessary. Commissioner Goodchild,
Yes.
Commissioner Bardwell,
Yes.
Commissioner Lutz,
Yes.
Commissioner Cook,
No.
Commissioner Vaughn.
Yes.
Motion carries. Thank you.
Thank you for that. Thank you for the presentation and good luck. Okay, move on to new business further. New business, we got animal control request to hire Christine Chiron.
Morning, Commissioners.
Morning.
So I came before you 2 weeks ago to request 2 new candidates for our vacant part-time kennel attendant positions. Unfortunately, one of our candidates, Brady Hudek, that you had previously approved for hire, will not be able to meet fulfill the requirements for the part-time animal control attendant position. So in response to that, I would like to make the request to hire Christine Kiran to be hired as the vacant part-time kennel attendant position at step 1 of $16.92 per hour. Effective hire date would be on or around October 1st.
Questions for Tyler on this?
Mr. Chair, I move to approve Tyler Ray, Animal Control Director, to hire Christine here to fill a vacant part-time kennel assistant position with animal control at step 1 rate pay at $16.92 an hour, with a start date on or around October 1st, 2025, pending a favorable drug screening, physical, and background check.
Support. To be moved by Commissioner Cook, supported by Commissioner Lutz. The move to approve Tyler Ray, Animal Control Director, to hire Christine Caron to fill the vacant part-time kennel attendant position with animal control at step 1, rate of pay $16.92 an hour, with a start date on or around October 1st, 2025, pending the favorable drug screening, physical, and background check. Any more discussion? Hearing none, all in favor say aye.
Aye.
So approved. Dispatch request for additional employee pay.
What a morning. Morning, commissioners.
All right.
Coming to you this morning in an unprecedented move to request an additional $2 an hour to the base pay of my dispatchers. Now, the reason I'm asking for this is we've heard from the prosecutor's office doing something similar, but my employees are hourly. They're not salary. And since August 11th, we have lost 4 individuals that have given their resignations, with a 5th one that's out on approved, an approved type of leave, leaving us 5 dispatchers short. My dispatchers, 5 of them are maintaining somehow 24-hour operations still. And they're going to have to do that. I'm going to ask them to do that. We have no other choice to continue that through at least January. And right now they're averaging anywhere from 54 plus hours of overtime per pay period. And I can only buy so many meals. I can only cook so many meals and treats and share an expression of extreme gratitude for the work that they are doing for our citizens. And the only thing that I can feel compelled very deeply to do is come to you and ask for that additional $2 an hour to their base wage until approximately December 31st of 2025. And I believe I've worked very closely with both Erica and Shelley. And then I believe since Connie has come on board, they've kind of brought her on the back end and looked at some numbers. It's my belief that 5 remaining employees, thank you for doing something with the insurance, because I have a strong feeling that number would be less after today. With the 5 remaining employees, we can move forward in a good gesture of gratitude. It's not precedent setting. But I believe with the 5 empty positions, even with the 3 that we've hired, 1 is a returning employee. He's got a few years of experience. But that's still full training, 18 weeks for our other 2 employees that we hired. They're not going to be due to be able to sit on their own until after the new year. And 4 of my 5 remaining employees are CTOs, or communication training officers, which, as you can imagine, brings on extra work for them. So if you have any questions, I'm willing to entertain it, and my assistants are here as well for any questions budgetary wise, or
How many are you down right now, John?
5.
You're down 5
I am
employees?
50% staffed. Yes, sir.
50% staff.
And these numbers, I will say, the average overtime hours would be higher, except for my deputy director has stepped up and has started taking on some overnight shifts to help alleviate some of my folks.
The fully staffed, you have how many employees?
10.
10. You got 5 right now, but you just hired 3 more, so you have 8 now?
Well, again, 1 will still have to be retrained because we've implemented new policies, new techniques to dispatching. I don't anticipate his lasting more than a month, and then he'll be able to fill a shift on his own. We had 1 that started this past Monday, but he's in 18 weeks of training, so he will not be able to work on his own until after 18 weeks. The next one will start next week, I believe, the 30th. And then our rehire will start on the 1st. So again, out of those 2, I say 2 because 1's a rehire. He'll be able to get back on the floor relatively quickly. Those 3 new hires do not or will not qualify for this additional $2 an hour. It will be for the original 5 right now that are putting in these extreme hours. And we're going to ask them to continue those extreme hours till January.
Other questions for John?
I do. What's this gonna do about contract time?
Well, again, it's my understanding that this is not precedent setting. It's being done in good faith to support them and appreciate them. I do realize the contract is going to come. And we're gonna have to negotiate that, but we are gonna go negotiate on the firm belief that it's at their current wage, not with this additional wage, because of the unprecedented loss of staff significantly within, 3 weeks.
So what is the numbers?
If I may?
Yep.
So we calculated out some numbers for the remaining pay. With the retirement, FICA, work comp, everything included, we came up with about $5,600 impact to the budget. And to answer your question, Commissioner Lutz, that is the stop of the December 31st, 2025, and it could be used, that could be considered during negotiations.
No, he has that in his budget all because of the employees that are there.
We believe he does. I didn't actually crunch those numbers. I'm not sure if Connie or Erica can speak to that.
So it's my belief. sorry,
Yes, that's okay. Go ahead.
In my 704 line, which is my employees pay line, with still having 2 spots remaining open at that normal rate of pay, that should be more than enough to compensate for the additional $2 an hour for 5 employees.
So he's used approximately 64% of that budget, and that's through the end of September. So we do believe that he can cover this.
Question, Chairman?
Yeah.
What, out of those 5 individuals, what are they averaging in terms of hours per week?
Well, right now they are averaging, and this is for the pay period that will end tomorrow. They're averaging 54 hours per pay period
Per person?
of overtime. Many of them are on day 26 of 30. Out of 30 days, they've worked 26 of them. And again, this is something we're asking them to do for another 3 months. And again, those numbers would be higher, except for the dedication of my deputy director has stepped up and went back to working the floor as a dispatcher, which she hasn't done in a few years. Otherwise, we are looking at those numbers being higher. I can tell you that one specific employee, this pay period that ends tomorrow, he has worked 78 hours of overtime. So these averages are just that, averages amongst all 5. But because of where these open shifts may fall, some will have more, like 78 hours. I mean, that's a literally 1-for-1 employee that he's working for. Otherwise, these numbers would be higher as well.
And based on the September 29th through the December 31st, 2025, have you calculated the cost of overtime that these individuals, based on that number of hours, would incur?
I have not gotten you. I can get you that number.
I'd like to know if it's more than $5,600 or less.
Well, I can tell you that out of my 706 line item, which is overtime, through the end of this month, I am over budget at 109%. The overtime is, and this is something I've addressed in the past. The overtime's going to go up, right? I mean, we only have 5 employees working for 10.
Well, logically, it would seem that if you're paying time and a half,
Yes.
you would exceed the cost of $5,600. I don't know that, but that would have been my position as a, this is this or this, overtime or this. What's the, since we don't know that, what's the impact on their psychological ability with those types of hours over the long haul? What do you see?
I can tell you that morale is probably the lowest I have ever seen it under any director. I can tell you that, and I think we all appreciate, especially our farming community, when you work these types of hours. And it's, unfortunately, our night shifters, I got a night shifter working a day shift right now. So they're not even getting the same sleep schedule. When we start depriving them much longer than the 4 weeks that we've been doing this, we're going to start seeing sickness creep in, especially with the weather changes. We're going to make mistakes. Unfortunately, in 911, mistakes are expensive. I don't know where we're going to be in January with their mental state, but I can tell you right now, it's not good.
Chair, I'm going to make a motion only solely because I believe the cost of overtime would be exceeding the $2 rate. And from the psychological aspect, Eric could cost the county. All hypothetical, but
We don't get both though.
Mr. Chair, can I make a statement? I don't think this $5,600 is gonna decrease overtime. If I'm missing something, that's not.
It's good.
This isn't
Overtime
a
is more.
5,600 versus overtime. This is gonna be an additional. And I don't have a problem with it, but I think we need to get that clear.
Overtime will go up. because
Yeah,
they'll be making
correct.
more money
Right.
than base pay.
Basically, you're asking for additional pay for the long hours. The only thing I disagree with you 1,000% is you saying that this isn't setting precedents. It's gonna set precedents come contract talks. So let's get that right off the table.
That's fine.
And that's just my personal opinion, but it's gonna. And I'm not saying you don't deserve.
That's something I have to say, right?
Yeah, but it's not, I'm not saying you don't deserve it, but that is gonna set precedents. And I'm just talking to the board.
And I appreciate that. And I'm not saying I don't disagree with you. But there are things that I see myself as a first sergeant. I don't know what we call them in the Navy, but I'm kind of the liaison between the commander and the troops.
Right.
So I take everything that I get from my troops, whether it's good, bad, or ugly, and I present it to the commander, you folks. And somehow I got to negotiate this.
And
So-
I'm not
so-
to cut you off, sorry. I'm not disagreeing with you saying it doesn't set. I'm just saying, my personal opinion, it's gonna set.
Oh, absolutely. And
So
I,
I'm not disagreeing.
and I have publicly said that, my staff traditionally has taken the lowest pay increases out of the county. Many years, they have taken 0 or 1.5%. So, I'm not setting the stage for contract negotiations. Again, I'm going to stand on, this isn't anything to do with negotiations, right?
Sure.
But I think it's sometime we have to prepare for that negotiation. Right.
So John, with you being the director, do you set desk?
No, I do not.
You don't.
No, sir.
And why would that be?
Number one, it was not in my job description. Number two, can I sit desk in an emergency? Yes, I can dispatch on radio, but I do not sit desk as a call taker because I'm not medically licensed. Why haven't I been medically licensed since I've started? Is because it not only incurs a cost, but it incurs more continuing education that is required by the state and additional cost on that. And sometimes it's already hard. For example, my 5 employees, if they're coming due within 30 days or 60 days, 90 days, the state gives us notices. It's hard to find training close or in person that I have to negotiate scheduling 5 people. And now all of a sudden you're taking 1 or 2 of them away to run a 24-hour operation. So have I taken some trainings? Yes, but I'm not licensed to do that.
Chairman, Commissioner Cook, you make a good point, and I was considering that, I mean, isn't the reduced cost. That's why I moved on to psychological. I don't know what the board's, propensity to risk with 5 people handling up to 70 hours regardless. What do you do between now and December? If you lose another one, you got this 18 weeks training period?
Yes,
Something
sir.
like
And
that?
ours is the shortest out of many
I mean, the
counties.
$2 is definitely for psychological reasons, ability, somebody's paying attention to us. But the other side of that, what do you do if you lose another one?
Well, have I worked desk in the past? Yes, I have. Have I offered to work desk currently? Yes, I have. But my staff have volunteered for those shifts. Said, in not so many words, you need to do your job over there. We will do ours here. Because again, when you run into an instance, if you haven't dispatched in 3 or 4 years, or you haven't dispatched at all, the only thing you're good at really is radio traffic. Now you're asking that one person, your one partner, to take on those additional roles to help you get the computer and all programs correct. So, you know, it does take a lot of, you got to stay at it. You don't use it, you lose it. And I don't have the time to use it.
Mr. Chair, I move to approve the recommendation of Dispatch Director John Ramirez that current dispatchers with at least 1 year of consecutive experience who have been working long hours during the staff shortage receive an additional $2 an hour per hour to their base pay effective September 29th, 2025, with an end date of December 31st, 2025. And I make that motion and reiterate it. I'm not questioning that they need it. I believe they do psychologically, like Commissioner Bardwell. But I just wanted to clarify, this is setting a precedent. That's my motion.
Support.
A roll call vote.
It's been moved by Commissioner Cook, supported by Commissioner Bidwell, to move to approve the recommendation of Dispatch Director John Ramirez that current dispatchers with at least 1 year of consecutive experience who have been working long hours during the staffing shortage receive the additional $2 per hour to the base wage effective September 29th, 2025, with the end date of December 31st, 2025. That is the motion. More discussion? I don't have any problem as long as I think that your budget is still intact. That'll support that. You know, we done that for the prosecutor. We made adjustments when that was going on. Is there a concern that this could be negotiated tag? Yeah, it's around all of them every year anyway. But we can't afford to lose any more people out there.
We cannot.
We cannot afford to lose.
We should be calling the question. Clerk,
I can call the question.
normally when, I'm asking, is this not?
We're in
overreach?
discussion right now.
No, I'm just.
All right.
Yes, we're still in discussion.
Proceed.
So it's been moved and supported and
So,
there has been support, so.
yeah, so I just said that hopefully we pass this, we'll keep what we have there.
Well,
That's my,
I do appreciate that, gentlemen. And again, I feel strongly compelled as their director to come and prepare this and present it to you. And
Chair,
we had a roll call.
we're still in discussion, right?
Yeah,
We got numbers to back this up, support it?
Yes, so there will be some budget amendments needed to make their overtime line item not over budget. But we are working through the 2025 budget sweeps to see where can we move money from. And we are working with Director Ramirez to make sure that, we're not pulling from an equipment line item that he has already expected to use. So we are working with him directly. Yes, it will be fine.
And I completely go with Commissioner Cook. I think you're setting a precedence, but I understand the situation. But I think you're setting a precedence for the contract.
okay, any more discussion? Roll call vote, please,
Thank you. It's been moved and supported to approve the recommendation of Dispatch Director John Ramirez that current dispatchers with at least 1 year of consecutive experience who have been working long hours during this staffing shortage receive an additional $2 per hour to their base wage effective September 29th, 2025, with an end date of December 31st, 2025. Commissioner Bardwell,
Yes.
Commissioner Lutz,
Yes.
Commissioner Cook,
Yes.
Commissioner Goodchild.
Yeah.
Commissioner Vaughn.
yes.
Motion carries. I have one follow-up question, Controller Administrator Dibble. Do we need a motion to now authorize those budget amendments as necessary?
Yes. Or we can do that at another meeting. We are working on budget sweeps for all special revenue funds. So we can either request it now, or it can be included in the one that we plan to have on October 13th.
That would be fine. October 13th.
October
Okay,
13th?
then we will prepare it at that time.
Just wanted to make
and
sure
have-
that you were covered, so.
Yes, I appreciate that, but it is included. We're doing reviews of all of 2025 special revenue.
Thank you for that moment, commissioners.
Thank you, Jody.
You're welcome.
Move on to number 5, emergency service request for portable radios, Steve Anderson.
Morning.
Good morning.
So this proposal is for new radios for the road patrol. It would be for 28 Motorola APX N50s. I did my research on these radios. I think this is the best bang for the buck. I got quotes for 3 different types of radios, the N50, the N70, and the Apex 6000. We do have a couple of Apex 6000s in the field right now, but those radios are coming close to the end of life for those as well. So that's why I'm recommending that we go with the N50. The other reason that's kind of driving this too is we need new radios in the jail. Obviously, if we buy jail radios, that would come out of the general fund. The radios that are currently in there are the ones that we started with back in 2011. So obviously those radios are very hard to buy parts for and anything else to upgrade, keep those going. So I want to kind of move radios around, buy new road radios, and then give the existing road radios to the jail to kind of keep those guys going. So I'm asking for permission to buy the N50s. They do have some new capabilities that are coming to life. They have Wi-Fi capability where they will be able to use the Wi-Fi system in a building to make the connection with the state system if the radio waves don't go through. So I think that's going to be happening here in the near future. So, and we'd be using money out of the fund balance to purchase these items. Any questions?
Hey, that's my job. Any questions for the
I see. I found the N50.
Mr. Chair, I move to approve the emergency service request for 28 portable radios from the Motorola APX N-50 quote number 3177227 in the amount of $156,274.16. In addition, one-time mic fee of $250 per radio in the amount of $7,000 for the grand total of $163,274.16 transferred from the road patrol fund to line item 207-309-971-000 portable radio in-car camera fund, and authorize all signatures as necessary.
I'll support that.
Moved by Commissioner Lewis, supported by Commissioner Cook, to move to approve the emergency services request for 28 portable radios from Motorola APX N-50, quote 3177227 in the amount of $156,274.16. An additional one-time mic fee of $250 per radio in the amount of $7,000 for a grand total of $163,274.16. Transferred in the road patrol fund balance to line item 207-309-971-000. Portable radio in-car camera fund, and authorize all necessary signatures. There's a motion, is there any more discussion? Hearing none, all in favor say aye.
Aye.
Thank you, gentlemen.
Thanks, Steve.
Thanks, Steve. Move on to number 6, the proposed 2025-13 resolution opposing House Representatives FY26 budget cuts to county revenue share.
Chairman, is this an urgent resolution?
I have no idea.
And the reason I'm asking, I had I'll explain later on the other business, a conversation with Greg Alexander, and I just texted him to confirm, who had a concern about a resolution. I didn't realize this was coming up today. I checked out the other resolutions and wanted to explain his concerns. And I'm not sure if it's this resolution. But I just wanted to put
I'd
that.
like into this a little more before.
Well, if you could, because let me just explain. He has asked on October 13th to be able to be zoomed in video at 8:15. And he wants to address the board on a lot of issues, the updates, and if that's a pleasure of the board. So with that, we would have to send his office the Zoom link. That and basically explain to them that this is out of Greg and I talking, that they probably don't know. To put him in the position, he's gonna be, I think he's in San Lac, he's not very far from here, but he got some time. So anyhow, we can put it on his calendar. So if we may, could we postpone this until we hear from him? If there's not a sense of urgency on.
Who requested to have this put up on
This
here?
came as a recommendation from Derek Merlot.
There, who?
Derek Merlot of,
Okay.
Mac, right?
Okay,
And I may be wrong, but I just wanted to make sure. We spent a lot of time.
I mean,
talking about it.
suppose, I guess it's gonna hurt if we propose it today, we propose it 2 weeks from now. It's not, you know,
And it'd be nice to hear from their other representatives too. We haven't heard from them in quite a while.
Commissioner Bardwell, that was Commissioner, or I mean, excuse me, Representative Alexander.
Alexander,
Thank you.
his office. And Chairman, I think the fact that I got this set up, I mean, I took advantage of talking with him because we've been working with the Amish and talking regularly. So if someone's talking to the other representative or even senators, yes, please, I would suggest that we set them up as well. Pleasure of the board.
yeah. So let's move this to 2 weeks Thursday,
Thursday or the third?
13th.
the 13th. because
Monday?
Something we want to put off on, yeah, we'll move it right to Thursday.
Oh,
We
you
could
want,
put
so-
it just right on the 16th because there's no action that could be taken unless you want to discuss it further on the 13th. Because you wouldn't be adopting it until the 16th.
That's what I'm saying, that's what, that's the 16th.
I believe, I thought
Or we could-
Commissioner Bardwell said the 13th, so I wanted to make sure.
Well, that's a committee of the whole. He just wants to address the board, but and perhaps this is part of it, but you wouldn't have to take an action until after. That's
Right.
committee of the whole. Could be that next Thursday,
Could be a CA thing, we could do it.
do a CA or.
This cannot be a CA because it requires a roll call vote.
Oh, that's-
So it would be actually a Thursday matter. So that's why I said we might, for efficiency, be able to hear from Representative Alexander on the 13th. You would have a couple of days to review this
Which is
and
on-
decide, and then we
okay.
can add it to Thursday for action
On the 16th.
on the 16th,
Okay.
if that's acceptable.
Mhm.
Okay.
Sounds good. Did we get all that? All right. Moving on to number 7. Requesting approval for overnight lodging in Bay City, Jody Fay, County Clerk.
Thank you, Commissioners. The conference for our United County officers has been set to be held in Bay City, which is closer than the travel policy. So I'm just requesting permission for that overnight stay because it can be granted with board approval. And I do have that in my budget. I don't know if you saw the email. I see it wasn't in the agenda, so I don't know if you have that or not.
Do you have any questions for Jody on this? Is there night classes over there too, Jody? Or something?
Yes, yeah, we start quite early in the morning and then we go, it would be right through the evening, so.
Any questions for your Madam Clerk?
Thank you.
Move to approve Jody Fetting County Clerk's request for overnight lodging to be reimbursed by the United County Officers Association Conference in Bay City, October 19th through 23rd, 2025.
Support it.
The move by Commissioner Barlow, supported by Commissioner Luce, to move to approve Jody Fay, County Clerk's request for overnight lodging to be reimbursed for the United County Officers Association Conference in Bay City, October 19th through the 21st, 2025. Any more discussion? All in favor, say aye.
Aye.
Aye, motion is passed. That takes us through, the new business. Anybody wants, we got right into the whole business and we want to take a break, a recess?
Yeah, take a recess.
All right, let's take a 10-minute recess and we join back here at 10 o'clock. With that, we're back in the boardroom. We'll just take a 12-minute recess because I was waiting 2 minutes for somebody who wasn't showing up. So, want to welcome back, and we're finished with the new business. We're going on into old business.
Commissioner, if we can interject just for a second, Shelley has one matter on our discussion for the dispatch. If we can revisit that quickly before we move on.
The effective date on that motion should have been September 27th, so my apologies. I want to do it at the beginning of a pay period. Otherwise, that would be 2 days of pay at the old, and then we'd have to do the rest in the new. So if we could amend that.
So,
please.
So if what we would need is a motion to amend, and the motion number is gonna be 2025-M-239. And we can really do it instead of we'll do it as a motion to correct the date from September 29th, 2025 to September 27th, 2025 for the dispatch step-up pay.
okay,
I'll make that motion.
Thank you.
Support.
so moved by Commissioner Lewis, supported by Commissioner Birdwell.
To correct the beginning date for motion 2025-M-239 from September 29th, 2025 to September 27th, 2025.
We don't have to have another roll call vote. We had a roll call vote. I think it'd be,
We would not, no.
any more discussion on that? Hearing none, all in favor, say aye.
Aye.
Motion has been amended.
Thank you for that. It does make it cleaner to have it start on the first day of the pay period. So thanks for that, Commissioners. And that was, just for clarity, that was included in the figure that Shelley had provided you. And she had, when doing the calculation for the figure she provided, that was as of the 27th. So that doesn't change that figure you were presented.
Thank you. We'll move on to old business. We have an updated financial 2000 budget process. That's in our packet. Do we need to discuss anything, or was it just FYI where we're at, or?
I would like some, an approval for adding the date. I did add to the last page, the calendar, the 9/23 to 10/7, the department and controller, work on the first draft. That is the dates for the departments and myself to put in the numbers to be able to prepare preliminary for you as well. And I did ask Connie to help me with the feedback from the clerk regarding adding in the last date of election regarding the millage on page 6. So that has also been updated. But no action is needed necessarily on page 6. However, I would like approval for the calendar updates.
Okay.
Do you have any questions on that?
Mr. Chair, I move to approve the 26 budget development calendar amended as presented.
Support. So moved by Commissioner Lewis, supported by Commissioner Goodchild, to move to approve the 20 budget development calendar amended as presented. Any more discussion? All in favor, say aye.
Aye.
Motion is passed.
Thank you.
Correspondence and resolutions. Anybody want to touch on the couple correspondence and resolutions that's in the packet?
Clerk Petting, I believe these were sent to you. Is that correct? These resolutions that are in the packet?
From the appropriate county clerk.
Thank you. So they were just, correspondence that we've received.
Okay. Well, let's move on to the Commissioner Liaison reports. We'll start with Commissioner Cook, who is absent, and Commissioner Goodchild.
Nothing to report at this time.
Commissioner Barwell.
Nothing to report this time either.
And I have nothing really to report at this time either. Commissioner Lutz.
I have nothing either, sir.
Anybody have other businesses necessary?
The chairman, I do just an update. In talking to Greg yesterday, he gave me an update on the Amish bridge that we've been working on for 2 years or maybe longer. Anyway, the DNR has approached him, or he approached them, and looking more favorable to do an easement, and he's going to pursue the application. So more to come on that. So that was the most positive news, and he was very positive about it. So more to come.
Anything else? I have one thing that needs to be addressed here with regret, and I'd like to read it to the board. This is Dear Chairman Vaughn, fellow commissioners. It is with deep regret that I write to you formally to resign from my position as Tuscola County Commissioner, effective Thursday, September 25th, 2025. I've had great pleasure in serving the people of our county. I'm honored I've been chosen for this role. My gratitude and well wishes extend to my colleagues, the board, and the dedicated county staff. I trust that you will continue to lead Tuscola County with wisdom and integrity. This decision did not come lightly, but after careful consideration, I have determined that resignation is in my and my family's best interest. I ask for your understanding and support. Thank you again for the trust placed in me to serve our community. It truly has been a blessing. I remain optimistic for the county's continued growth, prosperity. God bless Tuscola County. God bless the United States of America. With appreciated warm regards, John Goodchild. So, as of the 25th is
Today.
today, so we have to move forward on this, I think, Madam Clerk, as far as voting on this to accept the resignation for one, and put it on file.
I would recommend that you accept with regret,
With
and
regret.
then I will move forward in posting.
Appreciate that. Anybody got anything they want to say?
Well, John, it's been a very exciting time that you've been here. You've come in at a very interesting time, and I'm saddened to hear that you're departing, but I know you have a family, and just talking to you, I know you're juggling a lot of things. But perhaps in the future, you wanted to consider rerunning and re-engaging, and as time permits, but it is definitely with regrets. You're the youngest one on the board.
You could have actually maybe
But-
won the longest serving if you would have. It would have been in the running. for
If
it.
you did the longest search, why do you have a picture up there?
With many regrets, John.
Yeah, John, with many regrets. So we're gonna miss you. You've done a good job.
I thank everybody for the opportunity. It's been amazing, and this is something that it's not something I want to do, I guess necessarily, but for opportunities for my family, it just makes sense for me. But I think you guys will do a good job. But really, this opportunity has been amazing. We have learned more doing this, and I've done a lot of things in this short period of time. So really appreciate it. Getting to know everybody and understanding, a way better understanding of local government now. And, you get to actually see the people behind how everything moves and how much just one person can do or affect something is really cool. It's been an awesome opportunity for me. So very grateful for that from everybody.
We appreciate your steps, John. Again, I concur with the other commissioners with regret. We'll have to really accept this resignation. So if we get a motion to
I'll make that motion.
Support.
it's been moved by Commissioner Lynn, supported by Commissioner Bardwell, to accept the resignation with regret of Mr. John Goodchild, County Commissioner, District 1. Any more discussion? All in favor, say aye.
Aye.
Motion is passed.
And I will take a copy of that, please.
I was handing it your way.
Perfect. Thank you so much. Shelley, do you have a copy? I'll get you a copy.
Yeah.
Sure.
Do you have to make any motion or anything for you to move forward?
Nope, that's an automatic and
Okay.
that's in the big black and white book.
All right. Extended public comment. Somebody wants to address the board this morning? Extended public comment this morning. Somebody want to address the board? The record show, Madam Clerk, that extended public comment was offered. We had no takers. With that, we'll take a motion to adjourn.
I'll make that motion.
Or, I don't know if I.
Yeah, you still can.
So go down the record book one last time. That moved like it was supported like it was a good job to adjourn the committee meeting this morning. Any more discussion? All in favor, say aye.
Aye.
Meeting is adjourned. Thanks, everyone.
Yeah. I understand, like, it was supposed to be.
We are open to statutory finance part of the meeting. And
One more.
I call the meeting to order. We'll have a roll call by Madam Clerk Petty.
Thank you, Commissioner Goodchild,
Here.
Commissioner Barbell,
Here.
Commissioner Vaughn,
Here.
Commissioner Lutz,
Here.
and Commissioner Cook is absent.
Action on previous meeting minutes.
I'll make a motion to action of previous meeting minutes, statutory finance, September 11th, 2025.
Support. The move by Commissioner Lutz, supported by Commissioner Barbell to action on previous meeting minutes, statutory finance, September 11th, 2025. Any more discussion? All in favor, say aye.
Aye.
Aye. Motion is passed. New business.
Review and approval of the financial report and checks 9/25/25 financial docket.
Support.
It's been moved by Commissioner Lutz, supported by Commissioner Barlow, to review and approval of the financial report and checks 2029/25/25 financial docket. Any more discussion?
Chairman, just to carry over from the last, and I see the sheriff is here, perhaps for this, but there was a charge for $22,724 for the on-site medical. And in the last meeting we had, a finance meeting or statutory, we were gonna find out sort of some background on that, if that was a one-time pay or a yearly pay, or
I think that's the order
is that a quarterly
to
pay?
the, medical jail.
A month?
Two separate things.
Quarterly.
Sure.
Quarterly.
Yes. 1,500 and 22,000.
I also have it right here. The motion, that we approve the contract.
It's quarterly, though, right? It's a-
The quarterly?
I believe that was just the quarterly payment for the medical within the jail. And I know last time there was something mentioned about the $1,500 being separate. That's for the mental health so Shannon always sends it over combined, but they break it down, two separate charges just to try to clarify it.
The contract was for 3 years for $270,499. So May 1, 2023 to April 30th, 2026 for the total amount of 270,000. So divide that by however many months.
Thank you. No further questions, sir.
And I believe we need to vote on that.
Yeah. All in favor, say aye.
Aye.
Motion is passed. Review and approval of the day report checks.
Chair, I have a question on that one. If I may. Page 13, maybe I'm glad the sheriff is here. Says Duramix semi mixing nozzle for $74. What is that? It was bought at Advanced Auto, vehicle repair, it said. It says vehicle repair, says Sheriff Duramix semi mixing nozzle. Oh, okay. Okay, all right.
If
Thanks.
I may, Commissioner, it says shop supplies on the invoice.
Okay,
So that would concur.
okay. Chair, I review and approve the daily docket reports and checks 9/25/25.
Support. So moved by Commissioner Lutz, supported by Commissioner Goodchild to review and approve of the daily report and checks of 9/25/25. All in favor, say, any more discussion? All in favor, say aye.
Aye.
Motion is approved. Review and approval of the per diem report and checks.
Chair, review and approve of the per diem reports and checks September 2025 per diems.
Support.
So moved by Commissioner Lutz, supported by Commissioner Barwell to review and approval of the per diem report and checks September 2025 per diem. Any more discussion? Hearing none, all in favor, say aye.
Aye.
There's nothing under old business. Anybody want to comment on the statutory finance part of the business this morning? On the statutory finance part? That's record show. Public comment was offered. We had nobody participating. With that, we'll take a motion to adjourn the statutory finance.
I'll make that motion.
So move by Commissioner Lutz, supported by Commissioner Goodchild to adjourn the statutory finance meeting this morning. Again, thanks for everybody who tuned in this morning. And with that, all in favor say aye.
Aye.
Students passed.